on topic rather than speaking about the general ideas. Okay, so today from our syllabus we will cover our first topic, which is introductory to clinical oriented anatomy. The book that it is provided in our syllabus, it is like Morris Clinical Anatomy. Of course, you can study from any book you wish, anything that covers these kind of topics. Gray's Anatomy is really good. I would not advise you a smaller versions. Maybe for this topic it will be okay, but for in other topics I won't advise you any smaller books, as you need to cover the whole anatomy, and plus the questions are from the Moore's Clinical Oriented Anatomy book. However, for revision, BRS Anatomy, Gross Anatomy is really good, and even the smaller version, it is the High-Yield Anatomy. Unfortunately, the first aid USMLE step 1 doesn't have like the chapter of like anatomy, and it doesn't cover the anatomy. It has like under chapters for the systems, but not for the bones and the muscles, so that won't be useful. So mainly what we're stuck is Moore's Clinical Anatomy. Moore's Clinical Anatomy has like smaller version and bigger version. I advise you to study from the bigger version because it's our official book. Smaller version is missing some of the information, but for revision it is also good. Then comes BRS, and then comes the high-yield information. So what we are covering today, it is, as I mentioned already, it is like the anatomy, positions, planes and sections, structure of our human body, bone structure, bone physical and mechanical properties, classification of the bones according to the shape, and also human growth and development. The final topic, it is more, this is more, let's say, for the histology and embryology. You will go with in histology chapter one more time. I will just cover a small topics regarding that, and others are our anatomy topics. So to go on, to start our lecture, what's anatomy? Anatomy is a Greek word, and it means to cut apart, right? And back in like ancient, if we will see some kind of history, first person who started to draw the anatomic picture, it was Da Vinci, right? So after that, in World War II, the first album for topographic anatomy was created, and how they created that? By cutting a person apart, so that's how the anatomy was created. And anatomy is the field of the science that studies and concentrates on body structures and of course the development. And we are sharing the anatomy and studying anatomy in different perspectives. Let's say we're having regional anatomy, systemic and clinical or applied anatomy, and its body's organization and priorities and purposes, how we can study that kind of anatomy. So to be more precise regarding the anatomy, so as I mentioned, we're having regional, we're having systemic, and we are having clinical applied anatomy, right? So regional anatomy / topographic anatomy, it is considering the organization of human body as a major part of segments. So for example, in this photo you can see that we are dividing our human body in different parts, like we're having the head region, we're having the neck region, we're having the thorax, we're having the back, abdomen, pelvis, lower and upper limbs, right? So these are all the regions of our body that we will study throughout our course. Also, as you see, lower limb is also divided into the minor regions. We're having gluteal region, we're having anterior and posterior thigh region, we're having knee region, anterior and posterior leg parts also. So as you see, the whole human body is divided into the different regions, and we will study in details the topographic anatomy. Why it is important to know the topographic location if you want to be surgeon, and what part of the human body you are cutting, that's important to know, right? Another consideration how we are dividing anatomy by our studies, it is surface anatomy, and it provides the knowledge of what lies underneath the skin, and by our touch, what kind of organs we are touching. Why it is important for us, right? So before we are sending the patient to the X-ray or some technical diagnosis, let's say, we are palpating, we're auscultating the patient, right? So what organ we're palpating, what organ we're auscultating, we should know. And exactly, if you know very well the surface anatomy, that for example liver is located right upper quadrant, you will palpate the liver there, right? So that's why we need the surface anatomy to know. Do you have any kind of questions regarding this? Okay. And as I mentioned, we are having also systemic anatomy, right? And systemic anatomy, it is studying the organ systems itself and how they are working together in an anatomic perspective, because we are having also organ systems and how they are functioning and working through the physiology, and you will start studying physiology from another semester as far as I know. So we are having different organ systems, and these are all the organ systems that you should know, and currently today we will discuss our integumentary system a bit in an anatomic perspective. So we're having integumentary system, which consists of the skin, let's say. We're having vascular system, nervous system, endocrine system, skeletal, cardiovascular, lymphatic system, respiratory, digestive, urinary and reproductive, female and male reproductive system. And let's concentrate on what system is doing what. I guess you already know about that. So we're having integumentary system, and it is mainly the skin and covers our whole body. And on the skin we're having location of the receptors, so with the skin we can palpate, we can understand the pain, pressure, and etc., everything. And also it is a thermoregulatory organ, meaning that it has like the sweat glands, and yeah, we are producing the sweat, right, with that. Another, it is skeletal system, and in combination with our muscular system, we're having musculoskeletal system, and it provides us the locomotion, so we can move around, we can move our skeleton with that. And also, like a lone skeletal system function, it is to protect our human body, right? Another, it is like nervous system, and as the name implies, it is the nerves that we're having in our human body. And without the CNS and PNS, our human body would not exist. Then we're having endocrine system, and endocrine system is also very important as it provides the hormones, and hormones are the ones who are regulating our stage of development, let's say, in our digestive tract. And like, is how we are and how we feel, everything is done by endocrine system. The further system, it is cardiovascular system, and cardiovascular system is blood vessels and the heart itself, and it is like one of the main organ system that provides us that we are living, because the heart is pumping the blood, and in the blood we're having the oxygen that allows us to breathe, right? Drainage system, that it is also important for us, it's our lymphatic system, and apart from the drainage, it has also immune properties, and it is removing the debris, meaning the trash that it is in our body. It is done by the lymphatic system. And then we're having respiratory system, and respiratory system allows us to breathe, right? And with the combination of the cardiopulmonary system and CNS, we are staying alive. apart to these systems, we are having digestive system, and digestive system is breaking down our food into the smaller, like small and micro nutrients. So we're having the macronutrient that we are eating daily, and it is break down into the micronutrients, and it allows us to gain the vitamins and products that are mandatory for us to be healthy. And then we're having urinary system. It allows to remove the extra nitrogen from our body, not to be intoxicated. And final, it is our male and female reproductive systems. Of course, with the endocrine hormones, we are giving to theirs like offsprings, let's say, and they are regulating our production of the semen and the eggs, right? So all these structures working together are giving us the homeostasis and a person to be healthy. Yeah, I guess it's better, even. So as I mentioned, we will concentrate today on the integumentary system, and integumentary system is our skin, right? And you see the better photo of the skin here. And skin as main function, it is to protect us, as it is covering the major parts of our human body, right? So protection is happening throughout due to the environmental effects like abrasions, fluid loss, or like harmful substances, ultraviolet light, and of course the invading organisms like the infections and bacteria. Another thing is that also the skin can be injured, and injuring skin, it is like open portal in our inner self, let's say like that. So we are trying to cover the skin itself, right? Also, here skin is really good heat regulation, so meaning that we are having the sweat glands, and by sweat glands we are removing extra water from our skin. Skin has also, as I mentioned, like the sensation, so we can feel with the skin. And also, we are synthesizing vitamin D, and further you will study that vitamin D is really important for our endocrine system. So these are the main function of the skin, despite that we just think that it is our covering, right? Skin, as you see on the picture, skin consists of several different parts, right? We are having the 3 layers of the skin. First layer, it is the epidermis, the above layer. Here, this is the above layer, which is called the epidermis. And epidermis, it is avascular, meaning that it doesn't have any vascularity, meaning that blood is not going to the epidermis. Then you might ask me how the skin and the epidermis is functioning, right? Below the skin, we are having another layer. As you see here, we are having dermis, and dermis is vascularized layer. And as you see here, dermis is vascularized layer, so the nutrients and oxygen that it is coming to the dermis by diffusion is transferred to the epidermis. And the final layer that we will be discussing, it is like fats layer. We're calling it like subcutaneous layer, and in anatomy we will call the fascia superficial fascia. And this is this layer here. So what's the epidermis? As I mentioned, it is like the above layer. And we all see the epidermis of ours. It consists of keratinized squamous cell epithelium. That's why it can protect us from the microorganisms and protect our human body. Of course, we are removing the skin, like our skin has ability to be removed. Our epidermis is being removed due to the keratinization. And it's always renewed, right? Above the epidermis, as you see, we're having the dermis, and dermis, it's a big dense layer rather than the subcutaneous tissue or the epidermis, and it consists of the collagen and elastic fibers, and also it provides the tone for our skin due to the melanocytes that are located there. Apart from the melanocytes, we're having different structures like the hair follicle, and with each hair follicle we're having the muscle, erector muscle of the hair, which is giving us the goosebumps, and of course the sebaceous gland that are located next to each hair follicle. So that's how the goosebumps are created with the erector muscle of the hair, and also the sebaceous gland, as you see here. Sebum is coming out, right? Also, we are having different, let's say, receptors for the pain, touch, brutal touch sensation. And also we're having their vascular tissue, meaning the vessels, and also a lymphatic system, right? Apart from the dermis, we're having subcutaneous tissue, and subcutaneous tissue, it is underneath the dermis, and it consists of the loose connective tissue, and there is located the fat. Also, it consists with the sweat glands, superficial blood vessels, and lymphatic systems, and of course the nerves. In anatomy, further we will discuss like fascias, and we should know that the superficial fascias that are really close towards the skin, towards the epidermis, it is subcutaneous tissue, and it's another name, it is superficial fascia. Okay. Another thing that it is also important for us when we're studying the anatomy, we should know that on our skin we're having the tangent lines. As you see here, I guess if you will see the PPT more closer, you will see the dashed lines that are located on the skin on this picture, and you will see that on our skin the connective tissue and the fibers, elastic and collagen fibers, they are located in different directions, and they are called the tangent lines. Why it is important for us to know the tangent lines? Because when we are doing some kind of surgery or we are doing incision, it's better for us to cut on the tangent lines, because afterwards we're having more better healing. Because we're cutting the direction where the muscles are located, and we are cutting the direction where the collagen synthesis are normally happening, so it's better for us for healing. The skin has its own direction, right, as you see here. However, muscles underneath the skin that are located, they are having their own direction. So sometimes this skin direction and the muscle location, they are not the same direction. And that's why when we're cutting one direction of the skin, another direction cut we might have on our muscles, right? Also underneath the skin we're having skin ligaments. Skin ligaments are the ligaments that are attached in the skin towards the different deep fascias. So as you see here, we can do like, our skin is very loose, right? But we cannot move the skin because it is attached to the different structures, right? So if we will see inside, you will see the skin layer. It consists of the epidermis, dermis, and the yellow that you see here, it is our subcutaneous tissue, or another name can be the superficial fascia, and superficial fascia through the skin ligaments are attached to the deeper fascia, right? So you can move the skin, for example, here in this location on your elbow, I am moving right now my skin, but it doesn't mean that it is not attached. It is attached through the skin ligaments to deeper fascia. However, you are not moving the deeper fascia, and you are not allowed, like you cannot move from the skin the deeper fascia. You can touch and feel the muscles that are having deeper fascia attached real closely, and we will talk about the deep fascia. Do you have any kind of questions regarding the integumentary system? No questions. Okay, so then we will go to the clinical correlations, and exactly this is like applied anatomy, clinical anatomy that we've talked before. So integumentary system, skin has different colors, right? I mean, in colors, in medical condition colors, what does it mean? So normally skin can be normal, like it can be different colors, right? However, it is important for us to understand what this skin color tells us as a clinicians, right? Normally, the blood vessels that are underneath the skin, they are transferring the oxygen, right? If we're having deficiency of the oxygen, meaning that we're having cyanosis, the skin will appear bluish color. Why it is happening? So normally in the blood we're having oxygen, and it is carried by the hemoglobin, and hemoglobin color is really bright red. So if we are having deficiency of the hemoglobin / the oxygen, the reddish color will not go to the skin, and we will have more bluish color. When you can see the cyanotic patient, it is when we're having some kind of respiratory system problems, or maybe there will be hematology problems, meaning that hemoglobin won't be normal or something like that. Good example of the cyanotic patient, when you can see, for example, if you are staying in a cold weather too long, your lips and around periorbital, meaning around your lips, thus there will be your skin will become more bluish, right? Or sometimes when you are having like bluish fingers, right? Another thing is that sometimes when we're having the inflammation, meaning that there is some kind of infection going on in our human body, and our immune system is fighting against this infection, we're having erythema, so our skin is becoming more red, right? More red, and also it will be swelled, and also we will feel more warm, like it will be warmer than any other part. Sometimes even it is pumping, right? Another pigment that skin can have, it is yellowness. What does it mean? So we're having a liver disorder, for example, and in liver we're having this kind of ferment, let's say bilirubin, and bilirubin itself is yellow. When it is all gathered, bilirubin is building up in the blood, and it is giving yellow appearance to our face. For example, it loves the T-zones here, underneath the eyes also, and also the sclera area in the eye. So meaning that why it is important for us when the patient is coming to us to assess the skin color, because skin is giving us a huge clue what kind of disease a patient might have. Okay. Another thing is incisions and scarring, and as I've already mentioned, we're having tendon lines on the skin, and it is better for us to cut all the tendon lines rather than any other areas, because it gives us more variety of faster healing than any other part. However, in some patients it might give us even excessive healing, and the excessive healing, it is called keloid scarring. However, like we should ask in advance if the patient is having like, or in the family they are having like keloids, because it's a hereditary disorder. So if the family is having keloids, in that case we won't do the incision on our tendinites. Yeah. Another it is like our stretch mark. So skin is synthesized with the collagen, right? And we're having also hyaluronic acid there, so meaning our skin is really stretchy. However, it has its own capacity, and if we exceed the capacity of our skin stretching, we're having these stretch marks, and stretch marks are mainly located in the umbilical area, and they are more purplish in color. In normal cases, when we eat the stretch marks and they are not pathologic, it is due to the pregnancy or if a patient has gained a lot of weight, right? However, we might have the endocrine disorders, right, like Cushing disease or the hypercortisolism, where the patient is, of course, gaining the weight, and their stretch marks are becoming hyperpigmented, becoming more in purplish in color. And in that case, we are having pathologic stretch marking. Another question that students love to ask me, if any kind of creams or topical creams are helping for the stretch marks. The answer is like that, no. Nothing is helping through the, for example, the pregnancy stretch marks. It's just making it less painful, and it's kind of having the placebo effect. But in reality, it doesn't minimize the stretch markings. Another thing that it is important for us to know, it is the lacerations and burns. Lacerations are accidental cuts and tearing of our superficial and deep skin. And when we're having cutting, so meaning we are cutting the epidermis and dermis. And of course, as the dermis is involved there, we're having the bleeding from the skin. Depending on what kind of degree laceration it is, if it is epidermis, we don't need any kind of stapling or suturing or stitching. However, if the laceration is really huge, meaning really deep to the dermis and subcutaneous tissue, in that case we will need the stitching to minimize the scarring. And a final clinical correlation for the skin, it is the burns and burning, right? So burns are the thermal traumas or ultraviolet or ionizing radiation that, or sometimes the chemical agents, can burn our skin. And based on the what kind of structures are involved during the burning process, we're having several stages of the burn. And we're, as you see here, we're having the first degree burn. It is like superficial burn, and sometimes it's like everyone is having that burn. It is like the sunburn. And the burn is limited to the epidermis, and you can feel it because your skin is becoming more red. So you are having erythema, you are having pain, and you are having edema, meaning swelling. And after some time, you are having desquamation, meaning the skin epidermis is peeling off really well. And of course, afterwards, like skin, it is like replaced with the new keratinized epithelium, right? As you see here on the photo, this is the inflammation process, and all the epidermis is involved here, right? When we are talking about the second degree burn, we're having superficial and deep burnings, and these two photos are indicating the second degree burn. And mostly when we're having like superficial burning of second degree, it is partial thickness burning, and in the superficial one we're having epidermis damage with the blistering. And when we're having the deeper second degree burning, as you see here, our dermis is partially involved, right? It is also really painful. Nerve endings are damaged, so in that area, patient cannot feel anything, meaning they could touch or anything. So patient is losing the sensation, and healing is happening throughout 3 weeks. In the first degree burn, the healing process is really faster, so we are getting like desquamation and replacement. However, in the second degree, it is a bit slow process, so after 3 weeks, we will have like desquamation and renewal of our cells. And then we're having like third degree, and as you see, the third degree, it is the full thickness burn, so meaning the entire dermis will be involved, and sometimes it might go to the subcutaneous tissue also. And meaning all the structures that we are having in the dermis, like the sweat glands, nerve endings, vascularization, muscle, and hair follicle, they are all damaged. So that area of the person won't function at all. Healing occurs really stepwise, let's say. First of all, we will have like HR. HR means the dead material, like black dead material, we will have on that area. We should remove the HR, and afterwards we're talking about the grafting, meaning to replace the skin from another area, or like harvested skin, or even like autograft. Why? Because the damage is that much that our skin would not have ability with the stem cells to renew that part. Questions? You might ask me how we are calculating what kind of degree it is, right? And what kind of percentage of skin is burned. So normally our American Association of the American Burn Association has already decided what kind of percentage we are having on our body. So meaning that anterior head and neck fully consist of 4.5%. So if we are talking, if we are having like burn on our neck, it will be around like 4.5, depending what kind of areas it will be have. Anterior trunk, it has the majority percentage, and it has like 18%. Both of the limbs are having 4.5. Upper anterior thigh, it is having like 9%. The legs and feet and anterior thigh altogether, it is having the 18%. And we can decide like that. If we're having major burns, the third degree burns are over 10%, second degree burns are over the 25%, and first degree, it is like we even not counting it, it's the really minor point. So based knowing this percentage, then we can classify either it is first degree, second degree, or third degree. Questions regarding this? If you don't have questions, then let's start another topic, how we will communicate on anatomic medical language. And we should know the positions, lines, and planes, right? So, if we're, yeah. Third degree burn, it going to the epidermis, dermis, and sometimes minor superficial fascia. It never goes to the deep fascia. Because we will talk about the deep fascia, and if you will take the deep fascia, it is like exactly like maybe you have eaten chicken, right? And there is like the really thin membrane over the muscle, right? This is the fascia. So it is same as the muscle, but like, let's say wearing some kind of t-shirt. The muscle is wearing some kind of really tank top. This is the deep fascia. More questions? Okay. So we should talk about on the anatomic language, right? So we should know these words, and I would ask you to learn these words by heart, because when we are discussing some kind of structures after today's class, we will be using these words. Of course, due to the whole semester, you will hear it and you will learn, but on our first quiz, these words will be used, so you need to know. So we are having medial plane, and sometimes we're calling it medial sagittal plane, or even the midline, and it is like this line that it is cutting the person in two halves, right and left half, symmetrically. We are having also sagittal planes that are going parallel, that are vertical lines, and they are going parallel towards the median plane, and they are cutting the person not in the symmetrical parts, but they are longitudinal and they are parallel to the medial plane. So my median plane will be like me cutting myself in two parts, and on both parts will have upper limbs and lower limbs. My sagittal plane will be a bit right side or a bit left side in a vertical line. In my hand, my medial plane will be cutting the middle finger in two halves, right? So the part of the middle finger will be on the right, part of the middle finger will be on the left side, right? And the same will be on the foot. Sagittal plane, it's not cutting in the midline, it is like vertical to the midline. And yeah, it is a vertical line. We're having frontal or coronal plane. And it is also the plane that cuts the person into the anterior and posterior parts. So meaning, in other words, that we should know anterior, it is the front where the face is located, and the posterior, it is the back, right? So coronal plane, it is cutting into the anterior and posterior parts. We are having the transverse plane, and the transverse plane, it is a horizontal plane, like frontal plane, median plane, and the sagittal plane. All of that, like we learned, like median, sagittal, and the frontal plane, they were all the vertical, right? However, the transverse plane, it is a horizontal plane, and it is going throughout our body into the right angle to its median and frontal planes, and dividing parts our human body into the upper and lower body. So to see the plane, it is our transverse plane here. So it cut a person in two halves again, but it cut it into the upper and lower, right, parts. So one more time. Transverse plane has cut it into the superior, meaning the upper, and inferior, meaning the lower plane. Our frontal / coronal plane cut it into the anterior and posterior part, right? Median plane was like straight ahead to the midline, and sagittal was like vertical plane parallel to the midline. We might also have the paramedial plane, and it's sometimes our sagittal plane can be called as a paramedial plane. Also, regarding the frontal plane, how you will see our legs, how you will cut our legs, meaning that heel part will be located and toe part. So we are dividing like that. Okay? Questions regarding this? I guess it's really easy, right? Okay, apart from the planes, we're having also sections. Planes are taken, and we're talking about planes when we are talking about the human anatomy, right? But when we're talking about dissections, when we're doing autopsies and when we're having that person and cutting that person, right? We're having a longitudinal plane, and it is the plane that runs lengthwise parallel to its long axis of the body, and it is dividing the human body into the two parts. So as you see here, we cut it the length into the longitudinal section, so we are having two parts of that leg, right? We are having transverse section, or sometimes we are calling it cross section, and in your histology photos you will see like cross section, like after each word like cross section, because it is most commonly what we are doing and how we can see the tissue, for example, or the part of the human body. And it's a slice of our body. It is cut it by right angle, and it is like the transfer. So for example, if I want to take my hands cross section, I will cut like in the transverse section, right? And we're having oblique section. It is like again slice of our body, but taken more into oblique part. It's not cut it to the transverse line, but it is cut it more oblique line, let's say like that. So for example, if I'm cutting the cup, let's say, into transverse section, I will cut like that, right? Straight in a line, and I will have a section. But if I want to cut in an oblique section, I will cut like the angle wise, right? Questions regarding this? Okay. If there is no questions, then we're continuing, and we are having some kind of terms of laterality, it is called. So some structures we're having bilateral, some structures we're having unilateral. What bilateral means? Bilateral means that having this organ too, and one it is located on the right side, another located is on the left side. For example, our kidneys, right? Kidneys are located bilaterally. One kidney is located on the right side, another located on the left side. However, we are having organs that are alone and they are located in unilateral side. So for example, our spleen, right? It is located on one side and it is unilateral. Sometimes we are having organs that are located on the same side of one another, and we are calling these structures ipsilateral. For example, our thumb and our right great toe, they are located on the same side. If we are taking thumb of the right hand and the great toe of the right leg, they are ipsilateral towards each other, right? However, for example, we're having contralateral, meaning that the opposite side of the body, the structures are located on the opposite side of the body. For example, my right hand and my left hand, they are contralateral towards each other. Questions regarding this? To revise this slide, so we're having bilateral, both on both sides, unilateral, located on the one side. We're having ipsilateral, so two structures are located on the same side. And we're having contralateral, two structures are located on the opposite side. Okay? Okay. Now we're having another terms, and I will make a photo a bit bigger here so to see. I guess it's same, right? Okay. So we are having terms like superficial. Superficial, we already discussed it also. It is like close to your head, meaning the upper part. So, for example, my hand is now located on superior to my another hand, right? So if something is closer to your head, meaning closer to your vertex, we are calling it superior. Okay? Then in another way we can say superior, it can be cranial. And it is direct term closer to cranium, but we are mostly using cranial word to when we are studying the embryo and embryology. So in an adult human, we will say superior. But if we're having an embryo and we're discussing the embryology, we will say cranial. It is the same, closer to the vertex. Vertex is the highest point of your head. Opposite word for the superior will be inferior. Inferior means closer to your feet, right? So if something is, for example, something is closer to my feet, for example, the angle of this desk is closer to it's located inferiorly rather than superiorly, right? And another word for the inferior in the embryology will be caudal. It means closer to the tail, meaning that closer to our coccyx, that we will study that coccyx, it is the tailbone of our vertebra, right? So one more time to revise, the closer to the head, it is called superior. Closer to our toes, it is called inferior. In embryology, we will call it cranial and caudal parts, right? Then we already discussed anterior, posterior. Anterior, it is like front of surface. Another word for it, again in embryology, will be ventral. And posterior, it is back. And in embryology, we will say dorsal. Sometimes we are also, when we are talking about the neuroanatomy, we are using the anterior word as a rostral, but it is used always in the anatomy of the brain. We are having also, in other words, medial and lateral. Medial, it is closer to your medial line, and lateral, it is far away from your lateral middle line. So our anatomic position, as Da Vinci has painted, it is the anterior part will be our palms, right? So my fifth finger, it is closer, it is located medially, and my thumb, it is located laterally. Why? Because my fifth digit, it's closer to my middle line, and my thumb, it is lateral located because it is far away from my medial line, right? We are having also dorsum and palmar areas. So when we're talking about our hands, we are having dorsal and palmar areas. Dorsum, it is like this part that we might think that it is like the normal how we are walking, right? This is the dorsum and this is the palmar areas. However, in anatomic position, we are standing like that, so our palmar, it is anterior, and dorsum, it is posterior, okay? And regarding the our feet, we're having soles and dorsum, and again, in our feet, our anterior part will be dorsum, and our posterior part will be soles, okay? So as our anatomic position, it is as the woman is painted here, soles are front, it is called the anatomic position. We are having like anterior, the soles, and dorsum of our feet are our anterior, and soles of our hands, right? Questions regarding this? No. We're having also the surfaces. So when we're discussing the our section, we're having surfaces, meaning the superficial, intermediate, and deep structures. So superficial, it is nearest to the surface, to external environment. We're having intermediate between the surface and deep structures, and we're having deep structures, which is far away from the environment. So based on that, we will study the deep muscles, superficial muscles, and we will study intermediate muscles, for example. Let's have a break and continue in 10 minutes with the movement of our muscles. Okay guys, let's continue. So, we discussed how the structures can be located towards each other and what kind of terms we're using to describe our locations. However, we're having terms of the movement, and as you see here, for example, if we're having flexion and extension, and flexion it is indicating the bending process of some kind of organ like hand, feet, or like the neck, for example, or our back, and we're having extension. Okay, so we're having flexion, extension, and hyperextension. Same will be for the back. So for the back, like for example, this will be like my flexion. I'm now in an extended position, and if I want to like overextend my back, that I can't, and my back is not giving me, and ligaments is not giving me this kind of action, I can hyperextend myself, right? So for example, in this position, this for wrist, this will be flexion, and this will be extension and then hyperextension, right? This will be, questions regarding that. Same for the leg, right? Flexion, extension. Another thing that we are having, it is our abduction and adduction. ABD and ADD. It is like, if your ear cannot catch it, like ABD, abduction, and adduction. So abduction means moving away, and adduction means moving towards, closer. So if I'm abducting something, so I'm moving far away, and if I'm adducting with double D, I'm moving closer to myself, right? Then we're having opposition and reposition. Opposition means, for example, moving closer, so moving the digit to each other, and reposition, it is moving far away from each other. For example, the first digit, so this is opposition, this is the reposition. If you are moving something from normal location to another location, this is like reposition. You are having also rotation, and rotation involves turning around something, around the longitudinal axis. So if we are taking this line as a longitudinal axis and something it is rotating around it, like moving around it, it is called the rotation. For example, Earth is doing the rotation around its natural axis, right? So we are having medial rotation and we are having lateral rotation. Medial rotation, it is rotating internally, and if we're talking about like the lateral rotation, we're talking about rotation that it is done externally. We're having pronation. We should differentiate another word for rotation, which is for us circumduction. So for example, like right now, I'm circumducting my leg, right? Rotation is around the longitudinal axis, and circumduction doesn't have any kind of longitudinal axis. Then for example, I'm rotating my hand, right? So somewhere inside it is my longitudinal axis, and I'm rotating my neck around the longitudinal axis. For example, to better understand, the doors are having the longitudinal axis, so it is opening not only 360 degrees, but it is opening to 180 degrees, right? It cannot do the full rotation because of the longitudinal axis, right? However, if I will tell circumduction, it means that it will do the whole 360 degrees, okay? So if I'm rotating around something, then it is like circumduction. But if I'm having the longitudinal axis, then it is like rotation. We're having, in other words, that indicate some another movement. For example, we are having the protrusion and retrusion. Protrusion, it is like moving, for example, our jaw more front, and retrusion moving backwards. We're having eversion and inversion, and normally we are describing this for our legs. So inversion, it is when I'm doing inversion, meaning my middle part of my soles are open to my middle plane, and this one is eversion. So meaning that my soles are more open to the lateral parts. So in clinical pathology, you might see with neurologic disease, like some patient with inverted legs on everted legs, right? We're having bending, and bending, it's really common word, just like lateral bending during the normal exercises. We're having elevation and depression, and elevation is like moving something upwards, depression is moving downwards. So when you don't know something, you are doing elevation, and then you are doing depression. Then we're having retraction and protraction. Protraction, it is moving forward, and retraction, it is moving away. Same for the jaw. Protraction and retraction. Protraction, it is moving more front, and retraction, it is doing backwards. Questions regarding this? So one more time, let's go through over all the terminology that we learned, and then we're starting another topic. So we're having different planes. We're having medial plane, we're having sagittal plane. I will go by slides like that, so it would be easier for you to revise. We're having medial plane, we're having sagittal plane, we're having coronal slash frontal plane, and we're having transverse plane. All this can be applied to the sections. We're having longitudinal section, we're having transverse section, and we're having oblique section, right? We're having terms of laterality. It is like bilateral and unilateral, ipsilateral and contralateral. We're having then terms of location, like superior, cranial, inferior, caudal, anterior, posterior, slash dorsal and ventral, rostral, medial, lateral. Then we're having like the superficial, intermediate and deep, external and internal, proximal and distal. I guess we have not mentioned proximal and distal. Proximal, it is, let's say, when we are discussing the farther and closer attachments of some structure. For example, our proximal will be this part and distal will be this part, depending for example, for our fingers, right? Proximal is this one, dorsal is this one, so distal is this one. So closer to structure, it will be proximal, and farther from the structure, it will be distal. For example, for me, the proximal structure is my laptop, and distal it's my flex, right? Same for the muscle attachments. Then flexion, extension, plantar flexion, dorsiflexion, and hip extension, abduction, adduction. Then we discussed rotation, circumduction, pronation, supination, elevation, inversion, opposition, reposition, protrusion, retraction. And these were all the terms that you need to know to talk on anatomic language. I guess it's not hard, and it will be easier for you to memorize them. At least like we will be using it every day, and yes, you will memorize that. Questions regarding the terminology or anything that we have discussed already? Okay, if there is no questions, then we already discussed that we are having compartments, right? So meaning our muscles and our internal structure, they are located in some of the compartments. And we discussed that we're having superficial fascia, right? The subcutaneous tissue that it is covering our structures, and on the and above the superficial tissue we're having like the dermis and epidermis. It was our subcutaneous tissue, superficial fascia, right? So in general, what is fascia? Fascia is a thin packing, let's say, that wraps around some kind of structures, mostly like deeper structures. And we can have like superficial and deep fascia. Superficial fascia, it is almost everywhere because it is our subcutaneous tissue, and that it is really attached to the skin. So whatever the skin is covering, we're having the superficial fascia, right? And we're having the deep fascia, and it is more dense, more organized connective layer that doesn't have any kind of fat. It is devoid of the fat, and I'm highlighting this word because this is really good quiz question. Which of these fascias is having fat, which of the fascias is not having the fat? And the fascia, it is covering the most part of the body. And if we will see the fascia, it is kind of creating the compartment. In this photo, we can really closely see that this is our skin, like brownish in color, right? And then comes our superficial fascia in yellow color, right? Beneath the yellow cover, like superficial fascia, subcutaneous tissue, it is our fat, right? Fat tissue. And here we're having some kind of veins, nerves, and etc. Underneath the superficial fascia, you see the layer of white tissue here, and this is our deep fascia. And deep fascia has an inner and outer circumferential layer, and this is our deep fascia. Deep fascia, it is creating some kind of compartments, as you see, right? And these compartments are needed for our to like adjust some kind of muscles, right? When you will study the muscles, and in physiology and in histology muscles, you will understand that like each muscle band has its own fascia, right? And this will be our deep fascia. So as you see here, this is our deep fascia, and deep fascia is creating the compartments. And when it is divided into multiple compartments, we are calling it intramuscular septum. So the septum that it is between the different muscles, it is called intramuscular septum. Sometimes this intramuscular septum might not be just between the muscles, but it can be between the bone and the muscle, or vessels and the muscle. Okay? Yeah. So when we're doing some kind of incision during the surgery, we're cutting the skin, subcutaneous tissue / superficial fascia, and afterwards you are seeing the deep fascia. You should cut the deep fascia, then comes the muscles, and you are going through the muscles. Afterwards, depending on the region that you are doing the incision, you will see either different organ or straight ahead the bone. Okay? So by topographic anatomy, you should know that first comes epidermis, dermis, subcutaneous tissue, deep fascia, and the muscles, right? We're also having subserous fascia, and subserous fascia, it is normally lying between the musculoskeletal walls, and it is like covering the cavities from inside. For example, we can say that subserous fascia is covering our endothoracic or endoabdominal layers. So from inside of our GI tract, we're having the subserous fascia. We're also having the bursa, and good example for the bursa, it will be like this photo here. So bursa, it is a closed sac or sometimes we can call a closer envelope of serous membrane. Serous membrane, it is a connective tissue membrane that it is capable of giving us some kind of fluid that can lubricate that area. And normally bursas are collapsed. And if we will see the bursa, we should improvise that we are having a balloon and we are punching the balloon, and we are having some kind of two layers. We're having the outer layer, which we will further call the parietal layer, this one here. And we're having the inner visceral layer here. And between these, we're having free space where the fluid will be moving, and this is located around some kind of joint or bone. One more time regarding bursa. Bursa, I will say it one more time, maybe you will understand better. Bursa, it's a ball which consists of two layers, outer layer and inner layer, and inside it we're having some kind of bone. For example, this is my joint here, and around it we're having bursa, for example, right? And this bursa consists of the inner layer and outer layer. Outer layer, it is just protective layer, and inner layer, it is this membrane layer which is providing the fluidity. Okay. Another thing that we might have, it is we might have like not the serous bursa that it is providing us with the serous fluid, but we might have subcutaneous bursa, and normally it is just the balloon of the fat that it is located between the subcutaneous tissue and the bony prominences. So the bony prominences won't pinch to the skin. Or we might have like synovial tendon sheath. It is a specific type of the bursa that it is located in our synovial joints, and it is providing the lubrication. And when we will discuss the joint, we will talk a bit about this kind of bursa. Do you have any kind of questions regarding this? No? Okay. Yeah. And now let's start our bone. If you don't have any kind of question regarding it, then let's go and start our skeletal system. The slide that I missed, I've already talked about that. I just didn't show the slide because there was not a photo. So whenever you will read the PPT, you will see that we have done that. So we're having the skeletal system, and the skeletal system we should study. And we will study from the next class already. And skeletal system, we are dividing into two parts. We're having the axial skeleton and the appendicular skeleton. Axial skeleton is one which is consisting of the bones that are creating our axis. For example, our axis, it is our skull or cranium, neck, our cervical, and like our vertebrae, which is creating our back, ribs, sternum, and sacrum. So whatever is creating our head, neck, and our trunk, it is called the axial skeleton, right? And then we're having our appendicular skeleton, which consists of our limbs, and we're having 4 limbs, 2 hands and 2 feet, right? And also appendicular skeleton, it is the pectoral and pelvical girdle, meaning that on which our hands and legs are attached. So as you see this skeleton here, we're having the axial skeleton. It will be our cranium, neck, vertebra, ribs, right, and sternum. And our appendicular skeleton will be the shoulder girdle here with its hands, and also pelvic girdle, which with its legs, right. The bones are the dense connective tissue. It has the calcium in it and hydroxyapatite, right, in it. However, for movement, just bones would not be enough. We need something that it is more resin-like and more. Sometimes it is more flexible, and it is our cartilage. So here on this photo, you see the cartilage mostly in the joint areas, and I will just divide this photo here and make it bigger. So here, for example, the whitest materials that you see everywhere, it is our cartilage. And this exactly allows us and our bones to move really well, right? For example, when we're having the ribs, right? Ribs are attached to the sternum, and ribs are used for our breathing, because underneath the ribs we're having the lungs. So when I'm breathing, my ribs are moving, right? If it just be there, the bones, it won't allow us to move, right? So that's why we're having the cartilage, which is more resin-like, and it allows our bones to move, right? Also, cartilage is covering our articulating surfaces, and in that areas we're having the articular cartilage. What does it mean, right? Two bones are connecting to each other and they are creating the joints, right? So for example, this is bone A, this is bone B, and two bones are creating some kind of joint, right? However, when I'm moving, for example, let's say that this is my knees right here. I am moving, and the friction between these bones are rising up, right? And it will be super painful for us. That's why the heads of the bones, where they are creating junction, meaning creating a joint, they are covered with the cartilage, right? So it will be more smoother and less friction. Also, here we're having bursae in this kind of joint, which is creating a synovial fluid, and meaning that it is creating our surfaces of the bones really slippery, so it will reducing the friction, and we're having ability to walk without the pain. For example, a patient, when it is someone is saying that, oh my god, I'm having a knee pain, we might think that the patient is having decreased the synovial fluid, and that patient can feel all the friction that these two bones are giving them, right? So I guess you already know what the function of the bone is, and the bone's main functions are to support the body, right? Protect the body. Also, one and the most why we're using the bones, it is the movement. As I mentioned, bones contain salt like calcium, so it is a huge depot for the calcium. Also, some of the bones are creating, it has bone marrow, right? We're having the red bone marrow and we're having the yellow bone marrow, and the red bone marrow, it is a hematopoietic organ, meaning that it is creating the cells, blood cells. And as you see here, we're having the bone, and we're having different types of the bone, right? We can have the long bones, we can have the short bones, flat bones, irregular bones, and we will talk more in details about that. But inside the bone, if we're taking bone, we can have different types of the bone. For example, we can have a compact bone which doesn't have any kind of spongy appearance, any kind of tubercles in it, or we can have a spongy bone which consists of the trabecular bone, meaning that inside we're having a lot of holes. Some of the bones are having medullary cavity, meaning a huge hole where for example, some kind of maybe PNS is going there, some kind of brain is going there. So in this photo, in the first photo, you see the compact bone that doesn't have any kind of holes, and you see the spongy bone. You see compact bone, spongy bone with the medullary cavity. Here you see medullary cavity and compact bone. So the bones are different, and in different locations we're having different types of the bones. And based on that, some of them are having the brain, meaning that the spongy bone is having the red brain and yellow, and the compact bone doesn't have any. As I mentioned, as you see here, the bone, and I guess you have seen at least the chicken bone, it has like different tuberosities, grooves, shafts, and ridges, right? So here we will start discussing grooves and everything, but it's a bit huge material to just memorize, and I will advise you to, while you are studying the bones, come back to this slide and check the definition here rather than just like memorize it, okay? So each bone is having the tubercles, head, some kind of grooves, which is like the inversion in the bone, shaft, which is the main axis, and the ridges are some kind of outpouching on which we're having attachment of the muscles, right? As I've mentioned, our bones are classified according to their shape, and we're having the long bones, which are normal, the trabecular bones, and they are having like remitted in the humerus, for example, of the arm. We're having the short bones, and they can be cuboidal in shape or in different shapes, and we are seeing them in the wrist bones here or the ankle bones. We're having the flat bones, and our flat bones function, it is to protect, for example, the cranial head bones, like head bone, they are all the flat bones. Sometimes we're having like irregular bones, and irregular means that they don't have any kind of our well-known shapes. And this kind of bones can be, for example, the bones of the face. And then we're having sesamoid bones, and sesamoid bones are, for example, the patella or our kneecap, right? And meaning that they are really small, they are covering always some kind of a joint, and their main idea it is to protect the joint rather than protect any other part, right? And here starts the terms that we should know, like words that we should know about the bone. So that's why I advise you, when you will study each part of each bone, you just come back and check it. I will just run through it really quickly. So capitum, it is like the head, as you see on the photo here. Capitum, it is a small round head of the bone, and here you see the capitum of the humerus, for example. Condyles are rounded articular area, and normally they are located on the lateral side of the capitum. So for example, these ones are condyles. We are having crest, and it is just like rigid area outpouching on the bone where we are having the attachment of the muscle, and most common it is like iliac crest, that it is located here, this one. We're having epicondyles. Epicondyles are next to the condyles, and they are a bit smaller than the condyles, and again they are located on the lateral surfaces rather than the medial surfaces, and again they are attachment of the muscles. Then we're having the facets, and a facet, it is the small flattened area normally covered with the cartilage, and facets are creating the joint place. So here on this photo you see this kind of groove, which is a bit flat. Groove, it is more deep, however facet is more flat, and normally another structure is placed there, and both of them are creating the joints. Facets are really well seen in the vertebra, and from the next class we will talk about the more in detail of facets. We're having foramen, and foramens, they are the groove in the bone, and it gives us like passage through the bone, and normally we're having arteries and veins that are going through the foramen. Fossa, it is mostly a depressed area, and it's not giving us like the groove, but it is really depressed area. Groove, it is elongated depressed area. So if our foramen, it is like the hole, fossa, it's just depressed area, roundish, and groove, it is more elongated depressed area. We're having the head. Head, it is normally the round surface of our joint. We're having the line of elevation, for example, in line, it is like, for example, here we're having the line that it is going throughout the shaft of the bone, and some of the materials cannot be attached on it. We're having malleosis, and malleosis are just round processes throughout the bone. We're having notches, and notches are the elongated edges of the bone. Again, muscles cannot be attached towards it. We are having protuberance, and it is like projection from the bone. We are having the spine, it is like thorn-like processes. Like these are the spinous processes of the spine, right? It looks like the dinosaur sometimes, right? We are having trochanters, it is like more blunt elevation towards the head of some kind of bone. We are having trochlea, it is pull-like articulation processes. We are having tubercle, it is like small raised eminence, and we are having tuberosity, which is large rounded elevation. So these are all the terms that we are using to describe these or that areas on the bone. Like some of the bones, it doesn't mean that all the bones are having these all. Some of the bones are having some of the parts, another bone doesn't have any of it. So when we will discuss from the next class each bone, you will one more time go through these slides to understand what foramen means and etc. For example, condyle when we will be using. So when you will be discussing that bone, you should use the appropriate material, appropriate words to describe this or that bone, right? Okay. Questions regarding this? No. So when a child is born, they are super elastic, right? They can do any acrobatic elements, right? However, nowadays we are not able to do that like normal, the acrobatic elements. And this is happening due to the ossification. So the child, when they are born, their bone is not ossified, meaning that their bones are not hardened enough, and this gives them ability to do the elements. However, our bones are ossified, meaning are harder, so we are more stuck, let's say like that. So we're having different types of ossification. We're having intramembranous ossification, meaning that membranous bone formation, and we're having endochondral ossification, meaning the cartilaginous bones are formated through it. Now your next class with the histology and embryology will be about this. That professor will discuss it more in detail, these processes. I just want in anatomy you to know that this kind of ossifications exist, but we won't discuss it real deeply. So when we're having intramembranous ossification, we're having membranous bones created, and it is happening through the specialized cells, which is called mesenchymal cells. And this ossification is beginning from the fetal period. And when we're having endochondral ossification, it is happening through the cartilaginous bones, and we are having again it during the fetal period, and our cartilage is replaced with the normal bone. So sometimes it takes a lot of years to grow and mature our bones. For example, if we're taking the humerus, it begins to ossify at the end of the embryonic period of week number 8. However, for example, some of the bones are not ossified till the age of 20. So ossification is not just a process that it is finished after a baby is born. It is a huge process, and every bone has its own ossification age. All bones are having the arteries, and meaning the vessel supply, right? So vessel supplies are important because bones need to be, they are like growing itself with us, right? So we're having all bones, they are having like nutrient foramina, mainly in the shaft of the bones, and through the nutrient foramina, our arteries are going to the bone inside, and they are supplying the bone. For example, as you see here on the photo, we are having the long bone, right? You see the head of the bone and the shaft, right? And you see that our epiphyseal artery has entered the head, and they crossed the epiphyseal line and they went to the head of the humerus, this bone, whatever is painted, it's humerus here. So it entered the head and divided there. So the head has ability to gain the oxygen and nutrients, right? Also, we're having metaphyseal artery that entered the shaft here and then also divided. Also, we are having like the main arteries, like arteries and veins, and also lymphatic system, that it is providing the vascularization of the shaft, right? You might ask me, what's the periosteum that it is painted here? All the bones are having outer layer. It is called the periosteum, and periosteum can be peeled off sometimes. Yeah, and in the periosteum, everything like what it is crossing the bone, they should cross the periosteum to go inside the bone. Questions regarding that? No. Okay. If we don't have a question, then we're going through another material, which is joints. I've already mentioned that two bones together, they are creating some kind of articulation, and this articulation, it is called the joint, right? And we are having like different types of joints, meaning that they are classified according where they are located and what function they are having, right? For example, we're having synovial joint, and normally it is united by a joint, like two bones are uniting together, and they are creating some kind of capsule, and inside the capsule we're having two joints and some synovial fluid, right? So, for example, better to understand the synovial joints, let's see this photo here. Right, what we see there, we see two joints. We see bone, one bone and second bone, and they have articulated with each other, right? We see the cartilage covering their heads, right? Because articulator surface is covered with the cartilage, and around that, around these two bones, we're having some kind of capsule, right? And this capsule consists of the fibrous capsule and synovial membrane. The outer layer, what you see here, it is the it is the fibrous capsule that it is maintaining the capsule, maintaining the joint. And inside we're having this synovial membrane that it is providing the, which consists of the synovial cells, and it's providing the fluid that further it is here in the capsule inside. So it is like decreasing the friction. It is decreasing the friction of bone movement, right? Questions regarding this? So if we will see from the lateral surface of our joint here, this is our knee joint. An example of our synovial joint will be the knee joint, for example. Here we see the one bone, another bone, right? We see patellar bone, which was sesamoid bone, that it is covering the capsule of synovial joint. And we see the cartilage around the bone, like exactly whatever I discussed here, we're seeing here. However, two stuff are added here. We're having the patellar sesamoid bone, that it is covering the whole joint capsule. And also we are seeing here meniscus, right? It is filling the space of the joint. Apart from the synovial joint, we're having also fibrous joints, and fibrous joints are united fibrous tissue mostly. And fibrous joints we can easily see here in our skull, and our skull has different sutures, right? For example, this is here our coronal suture, and this is when two bones are created already, and after some time they are fibrous, becoming fibrous together. They are creating a fibrous joint, and it is well seen here in the skull. We're having different sutures, they're having different names. In body system 2 we will discuss that. So you just need to know that the fibrous joint, it is in our head. Also, we're having another type of our fibrous joint. It is called syndesmosis. And syndesmosis, it's dentoalveolar syndesmosis, a really good example. So if you remember, your teeth are located on the bone, right? So how your teeth are located on the alveolar bone, it is syndesmosis type. For example, another example for syndesmosis will be these joints together. So, for example, here you are having ulna and radius. So you are having arm bones, ulna, which is located in this area here, and you are having radius, which is next to the thumb. And these joints are stick to each other through the intraserous membrane. And exactly this intraserous membrane is giving us the syndesmosis type of joint. Yeah. These were the types of the joints we might see in a human body, right? However, we are having different types of the joints. We can classify joints according how they are moving. And here is a huge photo of how the joints are moving. And let's go through it and see different types. So we are having plane joints, and plane joints are permit gliding and sliding movements. What does it mean? So they are moving like this. So mostly we see the plane joints in the flat areas of our body. And for example, acromioclavicular joint will be our flat joint, and acromioclavicular will be here, this one. This joint here will be our flat joint. It means that acromion of the scapula, we will discuss, don't worry about the examples, you will know all the examples time by time. You just need to know what kind of movement they are doing on this lecture. So acromion of the scapula and the clavicle, they are having the joint, and they are having like plane joint, meaning that they are having abilities to slide and glide between each other, right? We're having hinge joints, and they are permitting the flexion and extension only. And normally this movement is happening in one plane, normally in sagittal plane. And these joints are uniaxial joints, meaning that they are having just one axis. And this one, it is like our elbow joint, meaning this joint, right? So this is the hinge joint, and I'm having just like two functions. I'm having the flexion and extension, right? Another joint that it is also important is our saddle joint, and it is allowing us adduction and abduction. If you remember, adduction abduction was going far away, and adduction with double D was coming closer, right? And this kind of abduction-adduction joint, which is our saddle joint, it is a biaxial joint, meaning that it has different planes. It has like frontal and sagittal plane. An example for that will be carpal metacarpal joints, like the first digit, for example, will be a saddle joint. Then we're having condyloid joints, and they are allowing us again the flexion and extension plus abduction and adduction. And this will be like metacarpopharyngeal joints, like these joints here in the hand. Most common time, and all the students love this joint, it is like ball and socket joint. And ball and socket joint, it is normally the synovial type of joint that we're having, and it is like located, for example, here at the tabulum joint, and it is allowing us, it's multi-axial, so we are doing abduction, adduction, flexion, extension, and rotation. Yeah. Another, it is our pivot joint, and pivot joint, it is an atlantoaxial joint in our cervical area, here, this one, and it gives us like the rotation. So I'm able to move my hand even though my whole body is standing in a stiff position. It is done by the pivot joints. Yeah. Do you have any kind of questions regarding that? So one more time to go through the joints, we're having the synovial joints, we're having the fibrous joints, right? Two types. And according to function, we're having plane joints, we're having hinge joints, saddle joints, a condyloid, ball and socket, and pivot joints. All of the joints, they are covered with the ligaments, and they, like this bone collaboration is always handled and attached with some kind of ligaments, and further we will study what kind of ligaments are located in this or that position. Okay. Do you have any kind of question regarding this? I really like these photos because like they are giving us like the schematic overview how joints are located and how joints are functioning, and it is always easier for us to understand how each joint is working on. Guys, do you have any kind of questions regarding this? If not, then we will finish today's lecture on this topic. When you will study further like these topics well, we will discuss already the clinical correlations for the joints and the general idea of the muscles. And from the next class, we will study the vertebral column, its muscles, and of course the bones. So for the next Monday, you will have till here, till the joints. I will explain the clinical correlation and muscle and start the vertebral column. Do you have any kind of questions? If you decide to read the Moore book, you will have pages, as far as I remember, from the second page till the 37. It is the full whole material for this lecture. Yes, on the first slide there is mentioned my email. So if you will have any kind of question, don't hesitate to message me there. And thank you for today's lesson. Hope you enjoyed it, and see you on Monday at 9 a.m.